In this video, nephrologists from the University of Texas and the Cleveland Clinic have found a way to help their kidney patients reverse CKD in just 6 months and cut their creatinine levels in half. Today, I've reviewed the work of some of the most reputable kidney doctors in the United States to share with you the most effective way to lower creatinine levels by half. Guys, the medical world is finally starting to move away from outdated treatments for CKD and toward methods that actually work. And guess what? They're using a natural, holistic approach. I've been saying for over a decade that CKD can be treated without dialysis, and finally, someone is starting to listen. As I predicted, when doctors and nephrologists focus on truly helping their patients instead of just rushing them into dialysis, the results can be astonishing. In the published documentation, not a single one of the 288 CKD patients, many of whom were in stages 4 and 5, had to start dialysis. You're going to love this. This is an incredible result because dialysis is typically initiated when patients enter stage 5. However, this doctor told their stage 5 patients, "No, you don't need dialysis. Just follow these steps, and you'll be fine." So what should we do to ensure our creatinine levels go down? Right, now you might be asking how we can benefit from their findings. What should we do to make sure our creatinine levels decrease? There are 4 steps that every kidney patient must follow if their goal is to avoid dialysis. Don't skip step number 1 today because it is the key for stage 4 and 5 patients to avoid dialysis. First, let's begin with step 1, which is diet. There's no way to improve GFR and creatinine levels without the right diet, there's no doubt about that. The doctors from the Cleveland Clinic have figured out how to make your kidney diet much more effective. How effective? One of their patients actually reversed her kidney disease thanks to this diet, and her creatinine level was cut in half. Her creatinine went from 2.0 to 1 milligrams per deciliter, which is amazing. Keep in mind that a level of 2.0 corresponds to stage 3B or stage 4 for a woman, so her kidney function was severely reduced before the intervention. But now, with a creatinine level of 1 milligrams per deciliter, her kidney function has returned to normal. They had to completely discharge her because she no longer needed a nephrologist at that point. And guys, if you think this is amazing, consider hitting the like button and sharing this video on social media so more people can hear the good news. What's tip number 4? How did they achieve this result? According to nephrologists from the Cleveland Clinic, if your goal is to cut your creatinine level in half, you need to focus on restoring your gut microbiome. As you may already know, your gut is home to a complex ecosystem of bacteria that are essential to life. These healthy bacteria convert our food into energy, produce vital nutrients, and prevent harmful bacteria from taking over and slowly poisoning the kidneys by releasing uremic toxins. Protecting these healthy bacteria is one powerful way to improve your kidney health. This is nothing new. I've been advising all CKD patients to eat more fiber and take probiotic supplements for a long time. What truly shocked me, however, are the results that nephrologists at the Cleveland Clinic are achieving with a fairly simple dietary intervention. Yes, creatinine levels dropped by half, no more CKD. What may be even more interesting is that these doctors have developed an amazing way to achieve rapid results in lowering creatinine levels. Let's take a look at the 4 dietary changes they recommend to cut creatinine in half. These nephrologists are helping their patients improve by suggesting 4 gradual dietary changes. The first step, as you might imagine, is cutting down on protein. I've never seen a CKD patient, stage 3 or above, improve without significantly reducing their protein intake. So that's always the first step. Next, the second step is replacing unhealthy foods with ones that actually benefit the gut: beans, vegetables, and seeds. These are the foods I always recommend because they're where most of our daily fiber comes from. The more beans, veggies, and seeds you eat, the better. Just make sure you're not getting too much protein from these sources. For example, prioritize green beans over regular beans. Then, the third step is adding foods that truly increase the population of healthy bacteria in your gut. We're talking about probiotic-rich foods here, and one of the best options, in my opinion, is kimchi. Most people, when they think of probiotics, usually think of yogurt, which I don't recommend because it's a dairy product. Fortunately, kimchi is far better than yogurt. It contains more probiotic strains and has no animal protein or phosphorus. It's also delicious and made from fermented cabbage, which provides even more health benefits. Now, the final recommendation from the nephrologists at the Cleveland Clinic might shock you. To further improve your gut health, you should try intermittent fasting to give your gut a rest. I don't know if that advice shocks you, but it certainly shocked me. In my experience, fasting works well for reducing calorie intake, which is great for diabetes and weight loss. But does it really give your gut a rest? Actually, there are some studies that support this theory, but most have been conducted on animals. There isn't a lot of scientific literature supporting fasting as a means to improve gut health, so I wouldn't necessarily recommend doing it right now. What I can recommend about intermittent fasting is that it's great for diabetes and weight loss. Still, these doctors have achieved some incredible results with this method. I mean, lowering creatinine from 2.0 to 1.0 is no easy feat, so my question is, have you ever tried intermittent fasting? Did it help your gut? Let me know in the comments. When it comes to gut health, I've seen great results with supplements, both probiotics and prebiotics. So consider adding both healthy foods and supplements to your diet if your goal is to cut your creatinine levels in half. By the way, the reason this method works is because it essentially turns your gut into a third kidney. If you want to learn more about how to use your gut as a third kidney. Our next topic today comes from the work of one of the greatest minds of all time, Dr. Joseph Pizzorno. Dr. Pizzorno is the founder of Bastyr University and one of the most respected naturopathic doctors in the world. I decided to include him in this video because his work can help address one of the biggest problems CKD patients face: kidney toxic substances. According to Dr. Pizzorno, if your goal is to cut your creatinine levels in half, you must aggressively reduce exposure to kidney toxins. So, what are kidney toxins and how do we reduce exposure? It's simple: kidney toxins are substances that are harmful to the kidneys. This includes lipopolysaccharides from leaky gut, toxins from smoking, and organic pollutants like glyphosate. Now, I know you don't smoke, so what I want to focus on now are kidney toxins from heavy metals and organic pollutants. Organic pollutants are chemicals that persist in the environment, accumulate in the food chain, and are especially dangerous to the kidneys of people with CKD because your kidneys can't properly filter them. Glyphosate, the herbicide known by its brand name Roundup, is a clear example of this issue. Although it is considered a possible carcinogen and banned in many countries, this herbicide is still used in the US, and you can be exposed to these kidney toxins through many types of food. But despite what people may think, you're more likely to consume this herbicide when eating processed foods than raw fruits and vegetables. Granola, instant oats, breakfast cereals, and snack bars appear to be the worst offenders. Since this herbicide is primarily used on crops like oranges, sugarcane, almonds, and soy, it might be a good idea to eat only organic versions of these foods. Now, there's also a natural supplement that can help detox these dangerous substances from your kidneys. This is something Dr. Pizzorno has prescribed to many of his patients with great results: ginkgo biloba. Ginkgo is a large tree with fan-shaped leaves, and its leaves are used to make supplements. It's commonly used to improve circulation, and this benefit alone makes it worth considering. But the main benefit you'll get from ginkgo is that it improves kidney function by offering protection against multiple mitochondrial toxins. Specifically, this natural remedy appears to be especially effective against glyphosate. Yes, this means that for some patients, ginkgo supplements can bring about rapid improvements in kidney function. If you want to try ginkgo, it's available as an extract. It seems to be most effective when taken in divided doses throughout the day, with a total dose of 120 to 240 milligrams. However, consult your doctor before using it. Ginkgo is a very safe natural medicine. Alright, before we move on to the second segment today, this will be very important, especially for advanced stage patients looking to avoid dialysis. I want to thank all the new channel members. Thank you so much for your support, it truly means a lot to me. This will help prioritize your comments for a response from me. You'll also get a shout out and be able to help me create more content that you love. So, thank you very much. Now let's take a look at the amazing work nephrologists from the University of Texas are doing. They've achieved outstanding results helping all of their patients avoid dialysis throughout the duration of the study, 6 months, as we can see. As I mentioned, not a single patient in this University of Texas study had to start dialysis, and 31 of those patients were in stage 5, which is truly remarkable. So how did they do it? This was possible primarily because they uncovered a little-known truth about advanced stage kidney disease. A large number of CKD patients begin dialysis due to medical errors. You see, when a patient's kidney filtration capacity begins to drop, many medications and procedures that were once safe become extremely dangerous. This includes very common prescriptions such as NSAIDs and proton pump inhibitors, as well as the use of contrast imaging, not to mention the prescribing of antibiotics and antiviral drugs. Yes, simply by completely avoiding these medical errors, which happen very frequently, patients were able to avoid dialysis. In fact, as you can see, the method these doctors used to help their patients escape kidney failure was incredibly simple. Just prescribe the usual diabetes and blood pressure medications, plus teach patients how to interact with their doctors to avoid dangerous mistakes. Who would have thought that if you stop your doctor from destroying your kidneys, you could delay dialysis longer? Well, we need some of those nephrologists from Texas for that. In short, if you can prevent your doctor from prescribing kidney-harming tests and medications, you're less likely to need dialysis. This is exactly what these nephrologists have just proven to the world. Now, it's also worth noting that avoiding drugs like NSAIDs and contrast-enhanced imaging is only half the equation when it comes to prescriptions that can damage your kidneys. Medical interactions are even more dangerous because they are harder to identify and can cause more harm. So the question is, how can you prevent your doctor from making mistakes that could send you to dialysis? Collect your health data. The big discovery that saved all those Texas patients from dialysis wasn't just the fact that certain drugs can destroy your kidneys, everyone already knew that. Their major discovery was a way to make doctors stop prescribing those medications. This is exactly what the study recommends you do if you want to avoid dialysis. First, every CKD patient should bring all their medication bottles to each doctor's visit. They say this is the best way for patients to discuss what they're taking, how, and why, and to learn more about their medications. But there's more to it than just that, of course. You see, The reason some healthcare professionals overprescribe or prescribe dangerous medications is because they don't know enough about their patients. They don't have a complete medical history, and they don't take the time to check what other medications the patient is already taking, which is very dangerous. As I mentioned, if a healthcare professional takes on a new patient, one of the first things they need to check is what medications that patient is currently using. After that, they can prescribe any other necessary medications, but unfortunately, that's not always the case. In fact, if your goal is to avoid becoming a victim of a medical error, it's also recommended that you bring your health data with you, your most recent blood test results, all the information from your personal health journal, things like that. Because when you're informed, you're in control of your situation, and you know what you're doing and why. You might have noticed that I skimmed over which medications are actually dangerous, and that's not because most doctors should already know this. I mean, at least I hope so. And that's all for today. Thanks for watching. Wishing you all the best. Goodbye.